Hi, I'm Beverly Chester, reading the Community Health Needs Assessment of Dayton, Ohio. The data was collected via windshield surveys as I drove around the city of Dayton. Internet research, including census data and other government entities, and interviews with locals. I interviewed one group of high school teachers and Dr. Apatow, who is the clinical director of the YWCA, the Young Women's Christian Association in downtown Dayton. Compared to its host county, Montgomery County, the state of Ohio, and the greater U.S., Dayton has abysmal health. It scores low or at the bottom of every health indicator and is in dire need of better services. Some services do exist, but it seems like the problems in Dayton are too vast and compound each other. So whatever services these groups provide doesn't do much help on its own, and these organizations need to do more collaborating. The community description. So the city of Dayton sits in the southwest corner of Ohio, about 2 hours east of Indiana, an hour north of Cincinnati, and an hour southwest of Columbus. So it's in a triad of bigger cities. It's at the intersection of two major roadways, I-75 and I-70. I-75 traverses from Utah to Maryland, and I-70 traverses from the Michigan-Canadian border down to Florida. So these two together covered most of the country and was important for factory commerce. We're in the Miami River Valley. Miami River is named after the Miami Indians who used to inhabit this land. And the Miami River and the Mad River run through Dayton. There are parks and playgrounds that overlook the river or use the watershed as its location. And it seems like Dayton has recently built several parks around the city to clean up the streets and to make it look more inviting. There are many empty and dilapidated homes. It seems like even numbers between dilapidated homes and homes that are currently lived in. This is a prior factory town, and unfortunately many of the jobs have been outsourced, so much of the factory commerce that once existed here does not anymore. And Dayton has this feeling of being a ghost town. Dayton has notorious substance abuse. In fact, it's the leading city for a number of deaths due to opioid overdose. The population itself consists of 140,000 people, so a big city, although smaller than Cincinnati and Columbus. It's 51% white, 39% black, and the remaining 10% are Asian, Latino, or two or more races. It has mostly high school education or less. Only about 17% of the population has a bachelor's degree or higher. There's a high unemployment rate. Again, many of the factories were outsourced and many people lost their jobs. There's a low median income due in part to the high unemployment rate. And at $27,000, that puts many families at risk for poverty. There's a high rate of violent crime, which probably is compounded by the opioid crisis here. So violent crime includes murder, assault, and rape as examples. And Dayton scores low on every health indicator. For the community health needs assessment, I want to use the precede-proceed model. I would like to gather information from the community on what they think are priority issues and what do they think are possible issues to actually improve around the community. I would want to invite community members, leaders, and local resources. I would want to identify the community desires and identify potential barriers to reaching them. I would want to encourage the local resources to form partnerships because right now it doesn't seem like there's much collaboration between them. So if they were able to put their resources together and align their goals a little more, they would be able to affect a lot more change. And then finally, I would establish a timeline, evaluation measures, and program implementation. Community statistics. The demographics, again, are 52% white, 39% black, 3% Hispanic, 3% 2 or more races, and 4% Asian. Education consists mostly of high school graduates and 17% bachelor's degree or higher. So a high rate of low education. The age range is in the Middle Ages, so it's not a particularly old city and it's not particularly young. The median household income is $27,000, again putting more families at risk for poverty. 9% of Dayton citizens are unemployed, and the unfortunate part is that is a good statistic for Dayton's history because that's improved from the previous 15% unemployment rate in 2010. The physical and social environment of Dayton, because Dayton leads in opioid deaths, there's a large crime index here, and the major roadways here allow for heavy commerce that once was used for the factory town, but unfortunately now is used for illicit drugs. There are many public parks around Dayton proper and many more on the outskirts, so it does have a lot of beauty to it, a lot of natural beauty to it, and I think Dayton is starting to encourage that more to make the city more inviting. Dayton is losing a lot of citizens as they either leave the city and move to the suburbs where it's cleaner, healthier, and safer. And then also Dayton is losing citizens to death, again due to the opioid crisis here. There are many dilapidated homes, often overgrown with vegetation. There are security bars over windows. There are doors that are boarded up with spray painted signs by the Dayton Police Department saying do not trespass on these premises. And from the interviews with locals and also from my experiences, I understand that those are crack houses. So the priority health issues of Dayton, there's a high unemployment rate, there's low education level, there's low income level, and that equals a high poverty rate. There's a high crime rate and a high rate of opioid overdose deaths. As you can see, the persons living in poverty, Dayton has a striking amount of people in poverty above its host county, the state of Ohio, and the entire United States. So here are just the data in chart form for the priority health issues, and you can see that unemployment, Dayton has double of what the entire United States is suffering right now. High school education is right around the same as the other statistics with Montgomery County, Ohio, and the United States. The median income level is striking. It's about half of what the entire United States has and notably less than its host county. And that is largely due to the unemployment rate here. The poverty level is double that of its host county, Montgomery County. The violent crime rate is striking, and the drug overdose deaths are unfortunate. Just incredible. So the chosen priority issue is poverty. I chose that because I feel that by alleviating poverty, the other problems that compound on poverty might also be alleviated as well. So populations affected by poverty included the Black and Hispanic minority races, the low education status despite race, unemployment, teenage mothers, single parents, people with unstable households, meaning they move more than once every 12 months, and people living in high crime areas. So again, by addressing the poverty level, I feel that other issues that compound it would be alleviated as well. So poverty is defined as income of $22,000 for a family of four, and with a median income of only $27,000, that puts a lot of families in Dayton at risk for poverty. So factors of poverty are low income, unemployment, low education, teenage pregnancy or single parent households, underweight birth, alcohol and tobacco use, and overweight or obese status, water pollution, poor sanitation, and air pollution. So in summary, the primary issue is poverty level. The compounding issues are the unemployment rate, the education level, median income level, the job market or unemployment, substance abuse, violent crime rate. Some resources that I found are Abigail's Journey. This organization works to improve the lives of children by providing adequate adult role models. They provide help with homework, a safe place to stay after school, role models for dressing appropriately and speaking well, and in boosting confidence. The YWCA of Dayton offers domestic violence prevention or safe housing from families with domestic violence, or just safe housing from the elements. And they also provide services for teenage mothers, women in need of housing and employment, and income subsidies. The CAP of Dayton is the Community Action Partnership of Dayton, and that is a group of organizations that seem to have some kind of collaboration, but again, there are no major goals listed on this website. It seems like these organizations have similar goals and they provide similar resources, but they don't do a whole lot of collaborating for one goal. And the OPHA is the Ohio Public Health Association, and that is, again, just more networking of resources. Here are the source slides, and thank you for listening to the presentation.